So first up is the acute and long-term effects of stress, specifically the physical responses. So what is stress? So stress is the sense of being swamped or the inability to deal with psychological or emotional tension. Stress occurs from anything that induces physical, emotional, or psychological distress. It is caused by anything that may cause disturbances to our homeostasis. So it is our body's response to pressuring situations.
Hello everyone, Roxandra here, and today I will be talking about the different types of stress that you may have. So there are two types of stress that you may have and will affect you. The first type is acute stress and the other one is chronic stress. So acute stress has a quick onset and it comes really fast. You will feel all the stress responses throughout the body swiftly, but it's only for a short period of time, which means you may come out of that stress very quickly. For example, when you are stuck in a traffic jam and as you step on your gas pedal, the car in front of you suddenly slams their brakes. So you have to make a very fast reaction. So you quickly slam on your brakes as well, and you start to breathe at a higher rate, and your heart starts to pump faster, and your breathing starts to get higher. Now, a quick trivia, all other animals have acute stress response. But luckily, for us humans, we have a chronic stress response. So what is chronic stress response? This means we have the capacity to have that stress response occur and have it to continue throughout the day or for a longer period of time. For example, when you're trying to go to school, driving down the highway, and you get stuck again in a traffic jam. So, as you step on your gas pedal, seeing that the vehicle in front of you starts to move, but then you notice that the vehicle in front of you slammed on their brakes abruptly. So, you have to have a quick response to that. So, you start to slam on your brake as well. And as you do so, your heart starts to pump faster again and your breathing gets higher and all in all feels jittery. You go on, you try to rush on your way because you're starting to get a little late for school. And as you arrive at school, you are late already. Your instructor starts to get angry at you and scold you for not being on time. And as you are sitting down in your classroom, you start to realize that you have left your assignment at home. So the onset of stress continues and just keeps adding up until you start to feel all of it at once and for a longer period of time. So chronic stress can also appear from a thought that you may remember something from the past or the present or think about the future, otherwise called overthinking. So this can add up to the stress you are feeling or can be an onset of stress leading to chronic stress, and it is long term and it just keeps going and going. So that is chronic stress. Now, how does stress affect our brain? Chronic stress can affect the brain size, its structure, and its functions. When faced by a stressor, a part of your brain releases cortisol. Now, cortisol activates the fight or flight response, but excessive amount of cortisol can damage your brain. For example, excessive amount of cortisol can cause the hippocampus to deteriorate. The hippocampus is the part of your brain that is in charge with learning, memory, and stress control. So the deterioration of the hippocampus may also weaken our ability to control stress. Cortisol can also cause the brain to shrink.
So what does stress do in our body? On your body? So all of these chemical changes have short and long-term effects on almost every system in your body. So first, in the musculoskeletal system, its short-term effect is your muscles tense up suddenly and then release when the stressors are gone. For the long-term effect, if your muscles are always tense, you can develop problems like tension headaches and migraines, as well as other chronic pain. For the respiratory system, its short-term effect, you breathe harder and faster and can even hyperventilate, which can cause pain attacks in some people. And its long-term effect, if you have asthma or emphysema, breathing hard can make it difficult to get enough oxygen. For the cardiovascular system, its short-term effect, so stress does in your cardiovascular system is your heart beats harder and faster and your blood vessels dilate, pushing more blood into your large muscle and raising your blood pressure. And its long-term effect is that it consistently elevates heart rate, blood pressure, and stress hormones can increase your odds of heart attack, stroke, and hypertension. These can also affect cholesterol levels and cause inflammation in your circulatory system. For the endocrine system, the short-term effect of stress hormones like adrenaline and cortisol give your body energy to either fight or run away from a stressor. So your liver also produces more blood sugar to give your body energy. And its long-term effect, some people don't reabsorb the extra blood sugar that their liver pumps out, and they may be more likely to develop type 2 diabetes. So overexposure to cortisol can lead to thyroid problems and affect your ability to think clearly. It can also cause excess abdominal fat. Did you know that in men, chronic stress can also affect sperm and testosterone production and cause erectile dysfunction and infections in the testes, prostate, or urethra? And in women, chronic stress can worsen PMS, cause changes in the menstrual cycle, and missed periods. It can also aggravate symptoms of menopause and decrease sexual desire. And lastly, for the gastrointestinal system, the short-term effect of stress, you may feel butterflies in your stomach, pain or nausea, or might even vomit. Your appetite can change and you can have diarrhea, constipation, or heartburn. And the long-term effect of stress in the gastrointestinal system, it can lead to severe chronic pain and changes in your eating habits. You can also develop acid reflux. So that's it for the acute and long-term effects of stress, specifically physical responses.
And now let's talk about General Adaptation Syndrome by Hans Selye. In 1934, Hans Selye discovered a new type of hormone. He gave rats daily injections of ovarian extract and found that the rats had enlarged adrenals and shrunken spleens, thymus, lymph nodes, and intestinal ulcers. Well, in 1936, Selye defined this series of symptoms in the experiments with the rats as the General Adaptation Syndrome, which consists of 3 stages. First, we have the alarm stage, the resistance stage, and the exhaustion stage. The alarm stage is similar to the fight-to-flight response, and the body mobilizes resources to react to the incoming nauseous agent. The resistance forces will be built up when the nauseous challenge is detected as continuing. The exhaustion stage will cause death if the body is unable to overcome the threat. The General Adaptation Syndrome, developed by Hans Selye, describes the pattern of responses that the body goes through after being prompted by a stressor. And now let's discuss the 3 stages of reaction to stress. First, we have the alarm reaction stage. In this stage, fight or flight response happens. This physiological reaction of the body enables the person to prepare on either run off or to protect oneself in a dangerous situation. When this happens, the body's response includes increase in heart rate, adrenal gland releases cortisol, and receive a boost of adrenaline, which increases energy. And signs of alarm reaction stage include dilated pupils, increased heart rate, rapid breathing, trembling, pale or flushed skin, and lastly we have the heightened senses. Well, in the second stage, which is the resistance stage, in this stage, after the body's response to the perceived stress, it starts to restore itself, decreasing the release of amount of cortisol, and the heart rate and blood pressure returns to its normal state. Even though the enters into recovery phase, it's still on high alert for a while. When you overcome stress, the body's recovery phase continues until the body returns to its pre-stress state. If the stress still continues in the period of time and still does not being resolved, Then the body remains on high alert and eventually learn and adapt in living in a higher stressful level. If the resistance stage continues without any break, then it can lead to exhaustion stage, and these are the signs of resistance stage. First, we have the irritability, frustration, poor concentration, bowel issues, headaches, sleeplessness, and lastly, we have the sadness. Lastly, we have the exhaustion stage. This stage is the result of prolonged chronic stress. Struggling with stress for a long period of time is tenuous, resulting to wear and tear that suppress the immune system, causing the body to deteriorate. This can lead to a variety of health issues such as heart disease, digestive problems, and depression, and many more. And signs of exhaustion includes fatigue, burnout, depression, anxiety, decreased stress tolerance.
Hello and good day everyone, my name is Vincent Amonakalar-Sana. I am the one in charge for the Psychoneuroimmunological Model, also known as the Psychoneuroimmunology or the Psychoneuroendocrinoimmunology. The main interest of P&I are the interactions between the nervous and immune systems, then the relationship between mental processes and health. The word psychoneuroimmunology was coined by Dr. Robert Ader and Nicholas Cohen in 1975. Now we move on to our next topic, which is the three currencies used for transactions in the P&I. The first of the three is our neurotransmitters, which has norepinephrine, epinephrine, serotonin, and etc. The second one are hormones, cortisols, thyroids, melatonin, and etc. And the third one is cytokines, which has IL-6, IL-1 beta, TNF-alpha, and etc. Now we move on to our next topic, which is the P&I triad in health and illness. It consists of our immune system, ANS system, and HPA axis. In the immune system, we have innate and adaptive immunity. Innate immunity is the defense system with which you were born with. It protects you against from all antigens. Adaptive immunity is the immunity that occurs from exposure against pathogens and vaccines. Immune response is the way the body defends itself against substances it considers as harmful or foreign. The second part of the P&A triad in health and illness is our nervous system, which is the autonomic nervous system. It has our sympathetic nervous system and parasympathetic nervous system. In our sympathetic nervous system, it is the fight or flight response. It is involved in preparing the body for stress-related activities and it slows bodily processes that are less important in emergencies such as digestion. In the parasympathetic nervous system, which is rest and digest, it functions as to conserve the body's natural activity and relaxes the individual once an emergency has passed. The third one is our HPA axis, which is the hypothalamic pituitary adrenal axis. It is a term used to represent the interactions between hypothalamus, pituitary glands, and adrenal glands. It plays an important role to the body's response to stress. The pathway of the axis results in the production of cortisol. The next topic is the neuroendocrine immune reactions. The crosstalk between the neuroendocrine and immune system is now well established in that these systems utilize several similar ligands and receptors to provide an intra- and inter-system network of communication. It is believed that the communication between these systems is essential for maintaining physiological homeostasis and good health. One, it has the sympathetic adrenal medullary or SAM that activates the autonomic nervous system ANS. The next one is the hypothalamic pituitary adrenal HPA that signals the endocrine system to release hormones. In our next topic, stress and immune system. When we're stressed, the immune system's ability to fight off antigens is reduced. This is why we are more susceptible to infections. The stress hormone corticosteroid can suppress the effectiveness of the immune system. Finding shows that the psychological well-being was proven could increase human body immune response. The evidence were by improvements of several indicators in saliva, blood, and plasma. In other ways, psychological ill-being was associated with decreased immune response. Now we move on to our next topic, which is the HPA and immune systems. There is a bidirectional communication between the immune system and the HPA axis. Pro-inflammatory cytokines such as TNF, IL-1, and IL-6 stimulate cortisol release by acting at all in three levels of the HPA axis, which is the solid blue lines in the diagram. In turn, glucocorticoids negatively feed back on the immune system to suppress the further synthesis and release of pro-inflammatory cytokines, which is the dashed red lines in the diagram. Now we move on to the next topic, which is the medical implications. As PNI has gained greater acceptance in the scientific community, the findings that emotional states can affect immunity has been an important one. Understanding the importance of how the interactions between logical processes and the nervous system and immune system of the human body can be detrimental upon treating patients and in order to reduce their stress. Now we move on to our nursing implications. Reducing stress in patients is an important and vital part of our nursing care. Patient experiences stress due to various reasons and is exacerbated by hospitalization, pain, surgery, or incapacitation. In conclusion, there is a definite tight bond between members of the PNI system and mental health. These can adversely affect short and long-term mind-body outcomes. Wise usage of pharmacologic and non-pharmacologic treatment options are available to address these issues holistically. So that is all for me. Thank you very much.
So now let us proceed with measuring stress. So how can we measure stress? We can measure stress through psychological questionnaires. So as we all know, psychology focuses on the measurement of abstract concepts such as language, cognition, personality, and emotions. Given that Mason's determinants of stress response were psychological in nature, concepts of stress was added to the list of psychological concepts that can be measured. Stress then became measurable through the use of questionnaires after it was developed in the field of psychology. So one example of a psychological questionnaire is the Perceived Stress Scale, or the PSS. It was developed in the year 1983 by Sheldon Cohen and his colleagues, and it is the most widely used psychological tool for assessing people's stress level. It is a measurement for how stressful certain situations in one's life are regarded. The items were created to gauge how unpredictable, uncontrollable, and overburdened respondents' life is during the last month. And a number of questions regarding the present level of stress are shown on the scale. The scale are 0 for never, 1 for almost never, 2 for sometimes, 3 for fairly often, and 4 for very often. In each case, respondents are asked how they felt a certain way. So here are the sample questions. For number 1, in the last month, how often have you been upset because of something that happened unexpectedly? 2, in the last month, how often have you felt that you were unable to control the important things in your life? Number 3, in the last month, how often have you felt nervous and stressed? Question number 4, in the last month, how often have you felt confident about your ability to handle your personal problems? Question number 5, in the last month, how often have you felt that things were going your way? For number 6, in the last month, how often have you found that you could not cope with all the things that you had to do? For question number 7, in the last month, how often have you been able to control irritations in your life? For question number 8, in the last month, how often have you felt that you were on top of things? In question number 9, in the last month, how often have you been angered because of things that were outside of your control? For question number 10, in the last month, how often have you felt difficulties were piling up so high that you could not overcome them? So in figuring your PSS score, you can determine your PSS score by following these directions. Reverse scores for question number 4, 5, 7, and 8. Then change the scores like 0 for 4, 1 for 3, 2 for 2, 3 for 1, and 4 for 0. Add up your scores for each item to get a total, and individual scores on the PSS can range from 0 to 40, with higher scores indicating higher perceived stress. Scores ranging from 0 to 13 would be considered low stress. Scores
ranging from 14 to 26 would be considered moderate stress, and scores ranging from 27 to 40 would be considered high perceived stress. So that would be all for measuring stress.
Now, let's go to the coping style. So first coping style is the emotion-focused coping. Emotion-focused coping is a type of stress management that attempts to reduce negative emotional responses associated with stress. So negative emotions such as embarrassment, fear, anxiety, depression, and frustration are reduced or removed by the individual via various methods of coping. So emotion-focused techniques might be the only realistic option when the source of stress is outside the person's control. Now, let's go to the different emotion-focused techniques. First is drug therapy. Drug therapy can be seen as emotion-focused coping as it focuses on the arousal caused by stress, not the problem. So, other emotion-focused coping techniques include: first is distraction. Example is keeping yourself busy to take your mind off the issue. Next is emotional disclosure. This involves expressing strong emotions by talking or writing about the negative events which precipitated those emotions. Next is praying for guidance and strength. Next is meditation. Next is eating more, or example of this is eating your comfort food. Next is drinking alcohol. Next is journaling. Example of this is writing a gratitude diary. Next is cognitive reappraisal. This is a form of cognitive change that involves construing a potentially emotion-eliciting situation in a way that it changes its emotional impact. So example of this is thinking that other people have a worse situation than yours. Now, let's go to the second coping style, which is the problem-focused coping. Problem-focused coping targets the causes of stress in practical ways, which tackles problem or a stressful situation that is causing stress, consequently directly reducing the stress. So problem-focused strategies aim to remove or reduce the cause of stressor. This includes problem solving. This is a coping mechanism in which identifying a problem that is causing stress and then developing and putting into actions some potential solution for effectively managing the problem. Next is time management. Next is obtaining instrumental social support. Example of this is if your problem is money, then you need to obtain money to solve the problem that is causing you stress. Other coping strategies, this includes humor, seeking support, relaxation, physical recreation, adjusting expectation, and venting.